weekend.
That works.
All right.
Good afternoon, everybody. This is the August 12th Thurston County Board of Health meeting, and we have come to order at
Other way. Yeah.
this meeting will be recorded via Zoom and will be made available for viewing on our website. First item on our agenda is the approval of the August 12th, 2025 Board of Health meeting agenda. Is there a motion to approve the agenda?
So moved.
And second?
Second.
All right, so the August 12th, 2025 Board of Health agenda is approved and we will.
Chair, can you repeat who the second was for the approval of the agenda?
Second was Mrs. Zinzelli Marshall.
Thank you very much.
Yes. Sorry about that. Just rushing ahead. So let's see, and the next item on the agenda is approval of our June 10th, 2025 Board of Health meeting minutes. You all had time to read them last week. Is there a motion to approve the minutes?
So moved. Second.
All right, you get the they work, okay, good. So the June 10th, oh, I guess I have to say, all in favor? I keep forgetting to do that.
Aye.
All right, and no opposed or abstentions? All right, approved. And next order of business is to proclaim August 31st, 2025 as International Overdose Awareness Day. And we already have our two speakers, Katie Strzik and Shandy Jenkins, here to say a few words about our proclamation. Welcome.
Katie Strzik, Opioid and Overdose Response Program Manager for Public Health. I just want to first off thank the board for proclaiming an International Overdose Awareness Day again this year. It's been multiple years in a row now that we've had all of our jurisdictions participate in this proclamation. It's really important to me, both personally and professionally. I've lost a lot of folks in my life to overdose. I'm a person with lived experience, and I also have helped folks in my life survive non-fatal overdoses as well by responding with naloxone. So I'm going to give the rest of the time over to Shani to talk about how this has impacted her as well. But I do want to pitch that we have our International Overdose Awareness Day event on Wednesday, August 27th from 2 p.m. to 7 p.m. at Heritage Park. There will be a flyer that gets sent out to the group as well. We'll have a bunch of different activities and ways to memorialize folks who have been lost, as well as to recognize the impact of overdose grief on the community. So from here, I'll turn it over to Shani.
Thank you. Hi, my name is Shani. Thank you for having me today. This means a lot. Again, my name is Shani Jenkins. I'm a longtime resident of Thurston County, where I raised my two boys, Ryan and Kyle. Almost 8 years ago, on October 7th, 2017, I lost my son Kyle, my beautiful angel, to an overdose from heroin inhalation. He was 31 years old. Kyle battled the disease of addiction for 10 years. After being clean for 2.5 years, we got our son back. He was excited for life and to be a dad. On that day in October, Kyle met up with an old friend, relapsed and died. 6 months later, his son, my grandson, Knox Kyle, was born. Kyle never got the chance to meet him, and that loss ripples through our lives every single day. I'm here today just not as a grieving mother, but as someone determined to change how we talk about addiction. This is not a moral failing, it's a chronic disease. And until we treat it that way with compassion and evidence-based care, we will continue to lose more lives. My voice is one of many, but I hope Kyle's story reminds us that behind every statistic is a real person and a family forever changed. I'll continue to speak out to fight the stigma and to honor Kyle and all those who have lost by pushing for change and awareness. Again, thank you for having me. You have any questions? I will be sharing, like I've done in the past, I've brought 32 banners. Each banner has 150 beautiful faces on it of people across the country that have lost their life to overdose. And so this year, instead of the whole banners, I'll be bringing a big TV screen and just have it playing all day. But when you see all those beautiful faces, it's very overwhelming. Yeah.
you maybe just give us the elevator speech version of how prevalent is first responders carrying naloxone now? And how have community treatment opportunities evolved?
Yeah, definitely. So we've had a huge expansion in naloxone access in our community, especially over the last 3 years. We've got a tremendous amount of distribution points across our community where folks can walk in and access naloxone, behavioral health agencies, housing providers, our syringe services program. We also just stood up a naloxone vending machine last week that's downtown Olympia, that's accessible 24/7, that has naloxone in it that anybody can get for free. We're in the middle right now of deploying naloxone boxes as well that are boxes that adhere to walls basically, or kind of like newsstand boxes that have naloxone in them that can go in high traffic areas. So housing programs or other interested agencies, we're especially looking at putting those out in rural Thurston County as well. We know that a lot of naloxone access is really saturated in Olympia or Lacey or Tumwater right now. So looking at having those boxes that have free access in other parts of the county as well. First responder access, all of our law enforcement carries naloxone. They have for years. Our EMS carries naloxone, and our local EMS have also stood up 2 programs in the last 6 months. One being leave behind naloxone, where when they respond to a non-fatal overdose, they're able to actually leave behind naloxone at the scene. We know that a lot of times folks may use their last naloxone when they're responding to an overdose when 911 is called, or there may be additional folks at the scene who need it. So EMS is actually able to leave that behind now. They also are able to respond to a non-fatal overdose and have that person get offered buprenorphine or Suboxone and immediately in the field. And then they're connected with a peer case manager within about 24 to 48 hours as well to continue that treatment and connect to other services. So other treatment modalities, housing, employment, and things like that. We also have had really robust treatment stand up in the last few years. We've got multiple treatment providers with multiple different approaches to treatment. We have inpatient treatment in Thurston County, as well as places where you can get walk-in access to buprenorphine or Suboxone. We also, I would love to highlight the tribes that have stood up new clinics in our area as well. We have the Chehalis tribe with Hope and Healing in Tumwater, and we have the Generations Clinic that's right on the verge of opening from Nisqually tribe. Both are phenomenal, beautiful facilities that really capture how substance use disorder treatment needs to be a holistic approach, where people are treated like human beings with compassionate care. And Generations really amplifies that with additional wraparound services such as primary care and dental services on site as well.
And BLS Narcan.
I said that one.
No, you said BLS Narcan.
Oh, sorry.
Our BLS provider.
BLS
saved a
Narcan.
puppy the other day with- was overdosed on fentanyl. You see that?
Mhm.
Lacey medic, he, well, it wasn't BLS, but he was on a BLS engine. And he found a puppy that was overdosing.
Oh,
on
I did see the
fentanyl in
puppy.
Back of a car after an overdose in the front of the car. And he administered it through the nose on the puppy and brought it back.
And the puppy survived.
Yeah, and it made nationwide news.
Yeah.
Yeah, I spoke to someone whose daughter was a vet tech and they said they had seen an increase in pets having overdoses and stuff. So I didn't know if that was something that had been talked about, actually. Seems like it has. So when there's at-risk populations and children and other people, and pets can also be included in that. I
Yeah,
imagine.
and at our community-based trainings that we normally do over 100 to 125 community-based trainings a year on overdose response and naloxone administration. We also emphasize in there that it can be used on animals. We've had multiple pets that have come through at our syringe services program where they've overdosed, especially puppies, because they just eat everything, that have been successfully revised with naloxone. So we let folks know that it's safe to give for animals and that it's the same medication that they would get as soon as they get to the veterinary emergency room as well.
Just wanted to remark, your program and other programs that are doing prevention of overdose across the state, it is amazing the creativity that goes into where you place those things. Kudos for that, putting it in boxes where there's populations and in vending machines and thinking about where people aren't receiving it is making a big difference on the ground. And so just appreciate your work.
We definitely couldn't do it without the input from folks who are actually using drugs too. It's one thing to see things from a programmatic standpoint in an office, but we really are able to make a bigger impact by listening to the folks in the community and asking them, like, where would you access naloxone? Where do you feel safe getting naloxone? Where are you at where there is no naloxone access, where there needs to be something closer, and acknowledging that there are transportation barriers. There's agencies that folks aren't comfortable going to that we shouldn't place it at, as well as trying to find where there isn't that naloxone saturation or pharmacy access nearby.
Thank you for being here.
Lyndall's my son.
Thank you for the work you do in the community. I'm
Thank
sorry.
you.
But
Thank you.
hearing about the work you're doing with newly bereaved parents, I know Kyle and I know way too many other people in his generation who
Right.
who
Lost a whole
lost. We
generation.
really have. So
lot of kids
admire
going
your
to s-
ability to turn it into something positive, very helpful for them.
I have a question. So as a pediatrician who's lost two of my favorite patients and still care for their family, is there any suggestion for me as how I support the family?
Just talk about it. I think there's so many people that
I've been,
they don't know what to say. They don't, the more we talk about it, I've been talking for 8 years. I even told Kyle, if this disease ever takes you, I will not be silent. And I have been vocal since that night on his doorstep. And, but people want to talk about their child or their family member and how much if they were loved. They're not, people picture as an addict, there's a lot of people that struggle and lose their life. He didn't struggle with fentanyl and I'm thankful for that. When I'm out there now, I guess that's why I'm not helping people that are in the addiction now, because I'm so unfamiliar with fentanyl. So now I help parents after they've lost their child to let them know that they're not going insane. They will get through it, so.
any other questions or?
I'd just like to thank you for being here today, truly, genuinely.
Thank you.
Thank you.
I have my little grandson this week and he is, I don't know how I can be like his dad, but he is.
Strong.
All right, so we'll read the proclamation and then we'll go out and take a picture in the lobby. Any preference for which end we start from? You guys all have it open.
Thurston County Proclamation, International Overdose Awareness Day. Whereas observed on August 31st every year, International Overdose Awareness Day seeks to create a better understanding of overdose, reduce the stigma of drug-related deaths, and create change that reduces the harms associated with drug use. And
Whereas overdose deaths occur in all communities among people from every walk of life, and
Whereas overdose deaths are preventable and can be caused by alcohol, over-the-counter medicines, stimulants, opioids, and other substances. And
whereas, like many places across Washington state, we need to continue to treat drug-related harm as a public health issue and invest in best practices that save lives and build communities. And
Whereas anyone can visit the statewide resource www.stopoverdose.org to obtain naloxone and opioid overdose reversal medication and the recovery helpline at 1-866-789-1511 for 24-hour information and help. And
Whereas Thurston County stands beside those who have lost loved ones to an overdose, those who have a substance use disorder, and those who are diligently working toward recovery.
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims August 31st, 2025 as International Overdose Awareness Day and encourages all community members to join in supporting persons in recovery.
Thank you, and then you can go out and take a picture that way. is to proclaim the month of August 2025 as National Breastfeeding Month. And Ashley Reynolds will say a few words.
Yeah, thanks for having me here. My name is Ashley Reynolds. I'm a registered nurse, board certified lactation consultant. I currently work as a home visiting nurse with the Nurse Feeding Partnership Program. I also direct the LIFT program, or Lactation and Infant Feeding, in Thurston County. And I'm the treasurer of the South Sound Lactation Network as well. I'm joined today, thank you, by some local human milk advocates. Sheila and Christina are both here today. And we stand to support the radical active human milk feeding and the many benefits it offers to us individually and as a community. I got it, don't do that.
Go the other direction.
This way? Okay, there we go. Okay, cool. So the month of August is annually the World Alliance for Breastfeeding Action. Their breastfeeding awareness. So this year's theme is prioritize breastfeeding, create sustainable support systems with an emphasis on the sustainable and climate-friendly aspects of breastfeeding. I don't need to say a whole ton about the benefits of human milk because I feel like we know this. And also I could talk about it for like days. But we know definitively that human milk is best for human babies and has proven long-term health benefits for infants, for children, and for parents, some of which are listed here. The AAP says the short and long-term medical and neurodevelopmental advantages of breastfeeding make breastfeeding and the provision of human milk a public health imperative. Breastfeeding is an investment in health. It's not just a lifestyle decision. The most recent data from CDC shows an improvement actually in breastfeeding initiation rates and the rates of infants breastfed exclusively at 6 months of age. So the graph is from 2019. CDC hadn't published a new graph yet, and I'm not great at Excel, so we just put the data on the slide. But we're actually seeing an increase in folks who are initiating breastfeeding and then maintaining that breastfeeding through the first 6 months of life. And then within Washington state specifically, we're seeing a slightly higher rate of breastfeeding initiation and exclusive breastfeeding rates at 6 months of age when compared to the national average, which is also pretty cool. Good job, Washington. I don't think there was specific data just for Thurston County because that can be really difficult to aggregate, but it's at least helpful to zoom out and look at the whole state. Even when we're looking at all of these improvements over the last couple of years, we do still have a lot of work to do. The Healthy People 2030 goal for breastfeeding is 54% of infants should be breastfed at 1 year of life. And currently we're at 39%. So we have quite a ways to go in the next 5 years. The gaps in what we're seeing in our community versus the goals we're setting for ourselves highlight the persistent barriers in accessing good quality lactation support that is evidence-based, that is robust, that is holistic, that is correct, and that is accessible for our families. And it's especially difficult for these for families to access this if they're part of our less affluent and non-majority culture communities. We know that many barriers exist in this sphere, and the data here talks about our racial and ethnic minority families, our younger parents, and our infants who are eligible for WIC. They are all way less likely to be breastfed at all versus our parents who are white, who have a higher education, who are not eligible for WIC. Many parents in the US stop breastfeeding sooner than they planned, and there's myriad barriers to parents stopping breastfeeding. We have clear data showing us the rich benefit that human milk feeding offers to our children and to our society, and yet we continue to promote policies that set up roadblocks to parents accomplishing their feeding goals. So what do we do when we have all of this scary data and all of these unmet goals? There's a specific local resource, obviously, because I'm part of Nurse Family Partnership, I'm excited to share about it. But the way this program is structured, nurses meet with families in their home. These are primarily first-time parents who are low income, high risk, and we have conversations with them. We build relationship with them. We offer tailored person-centered support to these families. And I hang out with them until their baby's 2. So it's a long-term relationship. Families who participate in Nurse Family Partnership are 21% more likely to be breastfeeding at all within 6 months. In terms of what's available within Thurston County, there's honestly there's a very big need in what is here and what families are needing and what's actually available for people to access. There's not very many support groups. I'm pretty sure I run the only one that's meeting in person. And the other ones that were happening just are not, they're just not happening anymore. The folks who are doing this work don't have time or don't have funding. There's very few private clinics that do one-on-one lactation support, and they often are really limited to folks who can afford to pay for those services out of pocket. Insurance doesn't cover that. We know that there's a lot of barriers with this. So the other ways that we can support these families is through community action, right? Things like La Leche Leagues, in-person support groups. South Sound Lactation Network has a really great guide for available resources in the community. And breastfeeding and lactation are a universally shared human experience. We all have to, we were all babies once. We all have to be fed somehow. As our board, your continued support for our efforts as both public health workers and lactation professionals impacts these little lives now, but also helps to shape the future. And I appreciate you giving me time to share that. Thank you.
Any questions or comments?
Yes, I have a question.
Yeah.
First, I'd like to thank you for the work that you're doing.
Thank
It's
you.
incredibly important,
Yeah.
especially you stating that, I mean, I think the Nursing Family Partnership Program is the only local program that's doing something.
Yeah, so the county itself is promoting, so like the lactation and infant feeding program is part of the parent-child health, division. And Nurse Family Partnership is one of the programs within that. So lactation and infant feeding lift, we're able to work with some of our NFP clients, but we also offer support to other providers in the community. I do education and lectures with hospital staff. I meet with some pediatricians' offices. I've done presentations in other settings as well. And we have an in-person support group for parents. So it's kind of we cover a lot of different things, right? So does that clarify the question that you asked?
Absolutely. No, thank you.
Wonderful.
I had a question about, one, there is gonna be, I think about roughly 14 like hospital closures,
Yeah.
specifically in rural areas.
Oh, yeah.
And specifically the midwifery
Oh, yeah.
like that's not being talked about. So I love this opportunity to plug that for people to know that's a very serious thing that's happening right now, not in 2 years, not in 4 years,
No, it's
right?
like happening right now.
It's right
It's
now.
happening now, yeah.
My question would be, what would your recommendation be for other public health advocates or entities to work more closely with doulas as they have
Such a good
recently,
question.
recently been able to do a lot more and they are getting approved via billing, right? So there are
Totally.
ways to do that. Like, what are your
Yeah.
recommendations for that?
That's a tough question. I feel like in the same way that Katie was talking about communicating with the people who are doing this work, right? Something that I've heard pretty consistently from other doulas doing the work in the community is that feels very new in some ways still. Like I've worked in birthing spaces for my whole career, so it's not weird for me to talk about doulas, but like that wasn't a thing 15 years ago. That wasn't a thing 20 years ago to have somebody in your birthing room supporting you during labor, in addition to the hospital staff or the birth center staff who were there with you, right? In addition to your partner who's supporting you as well. And so I think having a robust conversation with hospital staff, with OBGYNs, with midwives, and saying like, hey, that kind of support is actually really important in a lot of ways. And that does not demean or reduce the intensity or the importance of the work that you're doing as that labor nurse, as that postpartum nurse, as that OBGYN. This is just another person to come alongside and help share the load of what we're doing. And I think, I mean, I've already personally seen some of the benefits of having doulas covered by Medicaid. I've had many clients who have been able to have doulas during birth that probably wouldn't have been able to, or I know they would not have been able to without this particular benefit. So at least having that here and having that knowledge here has been incredibly profound. And I feel like sharing that information with more rural spaces and letting pediatricians' offices know, letting OBGYN offices know and being like, hey, listen, these guys we're on the same team. We're here to support these families. We want healthy babies. That's what we're all here for. How can we do this together really well?
Thank you.
Of course.
And of course, the impact of pressure on the system when
Oh.
you have things getting, less and less access because you have more and more closures is going to be a big deal.
Yeah.
And I mean, I have patients who drive over an hour because there's no access, so.
Yeah, one of the lactation clinics here in town, They get a lot of clients from the peninsula who come here because there's not service providers on the peninsula. They just like literally do not exist. Because insurance doesn't reimburse well for lactation services. So why, that's not a feasible job for me to have, right? Like if I don't get paid, I can't eat. So like that is really challenging for a lot of folks who are doing this work in the community is like, okay, well, if I'm not getting paid for this work, why am I doing this work? So it's really complicated. It's really complicated for sure.
I think another advantage of the people who, like having this much of our community who has nursed, like you can support each other and your family better too. So yeah, I think that's one of the blessings of living where we live.
Yeah, seriously, yeah. And I hear a lot from other parents that like communicating well with other parents who are experiencing this, that's usually the first place you go, right? Like it's 2 a.m. and your baby's crying at you, who do you call? You call your mom or you call your best friend? And if they have different views on breastfeeding than you do, that can really complicate that relationship. But if that's been really normalized within your community, if you have other friends who are also nursing at the same time, cool, that's who you're gonna call when you have questions. And then we can all work together to really support ourselves and build up the strength in that.
I also think it's important to know how closely tied in this is to maternal mental health.
Absolutely.
And if the policies aren't there to support things like this,
Totally.
it's almost a burden or it's heavier on mental health.
Absolutely.
Wellness to be like, I want to do this, but I can't because,
Right.
because of the barriers.
In my work as a lactation consultant over the course of my career, I found that a lot of my one-on-one consults really turn into basically a therapy session a lot of the time, where I'm really navigating those complex, intense mental health crises that these parents are going through. This is an identity situation when you're having a new baby, right? You're becoming a whole new person. And so having our staff who are really well educated about the benefits of promoting breastfeeding as a way to support maternal mental health, that's incredibly important, incredibly important. And we know like in the US, our maternal morbidity and mortality rates are egregiously high. And one of the, I think it shifts around on the list from year to year, but one of those things that often contributes to maternal morbidity and mortality is mental health crises, is women taking their lives because of the intensity of the situation that they're experiencing. And we know that maternal mental health conditions are treatable. We can do this. We have the ability to do it, but our systems just do not support that. And it's really hard.
So thank you for the work.
Of course, thank you.
I have a question.
Mhm.
So one of the statistics that was provided, right, is younger moms, ages 20 through 29 are less likely to breastfeed. And I'm wondering, is it based on education? Is it based on workplace availability? What is the driving factor on why younger moms?
That's a really good question. And I feel like that particular data point from CDC is not, I would love more details on that particular data point because like it's complex. There's so many factors there, right? I think a big burden that I see is cultural opposition to it. A lot of folks just feel weird about breastfeeding if they haven't seen it normalized for them. Also, barriers in the workplace are really significant. Legally, federally, you are supposed to, like every workplace is supposed to provide a safe, quiet, lockable space for a parent to be able to express their milk. And a lot of folks have issue actually securing that in their workplace. Like someplace like the county, it's not that difficult, but like if you're working at Jack in the Box, they don't give you a space to go pump. So that can be really complicated. And that can contribute to folks choosing to stop breastfeeding earlier as well. The need to return to work sooner is often a really pressing factor in choosing to stop breastfeeding or to stop expressing their milk in any way.
And just to clarify, they're not choosing.
That's true.
Yeah,
They are
they're
having that choice made for them.
Yeah.
Yes, that is so true. They are having that choice made for them. Yeah,
So I heard you say a lot of people from the peninsula
yeah.
they don't have these services, and so that's a long ways for them to drive. Have you looked at trying to do something from like a Zoom or informational?
Yeah.
I just think back on, raising daughters, and to think that their mothers have to travel that long on top of
Totally.
all the responsibility.
Totally.
That would save a lot.
It absolutely would. So there has been a real blossoming of virtual lactation services in the last several years. A lot of clinics can provide virtual visits. There's some like national groups like the Lactation Network, I think, that can help you connect with providers virtually. But there's a lot of difficulty with providing virtual lactation care. A huge component of my job when I'm providing lactation support is actually a complete oral motor assessment. So I'm putting my fingers in the baby's mouth and I'm looking at the structure of their palate, their tongue. How does their tongue move? What's the tissue underneath their tongue? Is their jaw really tight? Are they holding their body really weird? How do they do when they're sucking on my finger? Is that the way they're supposed to be sucking on my finger? Are they actually pulling milk out of the breast when they're nursing? So a lot of those things are extremely challenging to do when you're in a virtual space. It can happen, but it gets really awkward when you're holding a laptop and you're like, actually, can you turn the laptop camera a little bit this way? I can't see that very clear. Can you move your breast a little bit? So it can get a little hairy. We can do it. We make it work. But there's a real benefit to having that person, having that service provider with you, actually physically doing the exam on your baby and actually physically doing the exam on your body as well. Because there's a lot of things that look different in person versus online, right? There's a lot that can be said about like a physical assessment of like, what am I feeling? What am I seeing in person versus what am I seeing on the screen? So that can definitely fill gaps in some ways. And a lot of folks who need lactation support don't necessarily need the big guns, the IBCLC to come in and do a crazy oral motor exam. Sometimes it's like, oh yeah, your positioning is just a little bit off. Or, oh yeah, have you tried feeding this way? Have you tried this position? Maybe you shouldn't be doing that and you should try this instead. And a lot of those conversations can happen virtually, but it's also really challenging for those folks who do have really high needs, who then need to come in person. And it's just, it's such a challenge when there's not those providers where those people are.
Well, thank you. It's
Yes,
been.
thank you for having me.
Right, so now we will read the proclamation and we'll go take a picture. Are you okay starting?
Thurston County's proclamation, Breastfeeding Awareness Month, whereas breastfeeding and chest feeding provide a safe, reliable, and renewable food source and foster a strong emotional bond between parent and infant, and
Whereas breastfeeding can lower maternal risk of heart disease, type 2 diabetes, and certain breast and ovarian cancers, as well as lower an infant's risk of ear infections, respiratory infections, childhood obesity, type 2 diabetes, and sudden unexpected infant death. And
Whereas although major medical authorities recommend exclusive breastfeeding for 6 months and continued breastfeeding for at least 1 year, 60% of mothers stop sooner than planned, falling short of national goals. And
Whereas employers that provide workplace lactation support experience an impressive return on investment, including lowering healthcare costs, absenteeism, and turnover rates, and improve morale, job satisfaction, and productivity. And
Whereas chronic underfunding and policy gaps in public health disproportionately affect BIPOC communities, resulting in reduced breastfeeding rates and an associated increase in risk for a variety of negative health outcomes. And
Whereas the goal of our county government is to improve the county's health by working collaboratively to protect, promote, and support breastfeeding. And
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims August 2025 as Breastfeeding Awareness Month in Thurston County and encourages the community to address chest feeding disparities and support equitable breastfeeding care and education for all parents. Yay.
There is a handout that you can share and use in your packets.
Very nice. The next order of business is to provide an opportunity for the public to address the board. And I don't have anyone signed up, but I just wanted to do a last call in case anyone online or in the room wanted to say anything?
In the waiting room.
All right, so I don't hear any takers. All right, so our next board item will be to discuss the Board of Health bylaws and kind of follow up on our process discussion. So let Dr. Bryant to update us.
Yes, thank you. This is a continuation from the discussion from the original list that members Zali Marshall had sent to us with some suggested improvements for process. So just as a quick follow-up, and more will continue to come from this, but the additional items we talked about in our recent meeting in between June and now was the suggestion for financial reports, which there isn't really much of a need as the Board of Health doesn't have a budgetary or fiduciary oversight. And so that is not necessary, but members can always request information related to PHSS programs, budgets, that sort of thing, if via email if desired. There was the recommendation for legislative updates, and immediately following this email that came back in the spring, we started adding that with our policy program manager / Board of Health clerk. And so we will continue to provide legislative updates as our state agency, WSALFO, the Washington State Association of Local Public Health Officials, also puts out all sorts of reports and things for us as well. For example, right now they're developing a succinct report on the Big Beautiful Bill and how that will affect public health. And so we will share that in the future as well too. The next item was an annual report, and this was actually part of the strategic plan that we discussed and developed last spring. And so we will be talking about this at the October meeting, and we will be looking at the need and what would be included in an annual report in October. Two more items. One was on clarity of communication protocols. And so we discussed how members can send a request to myself or the Board of Health clerk for any questions or communication you'd like to have on open discussion or for the Board of Health or future presentations. So please do always communicate if you have a request or an idea. And then the last one was actionable initiatives. And this goes back to the whole reason why subcommittees were developed for the Board of Health to be more actionable and mindful about proclamations and the actions that we're doing. So I think that will also come at our October Board of Health when we review the strategic plan as well, and the nature and structure of our subcommittees, the need for that, and what actionable items, as we also discuss the bigger role of the Board of Health and what being actionable means. So we will have those discussions as well in the future. So that was all there was on that.
All right. And the next item is to discuss that technically my term ends on September 11th. And I noticed that and I was like, what do we do about that?
So we can extend the term. I believe we had to do this as well for Chair Vasquez, to extend it through the end of the year. That is the desire of the group. And Thurston County appointment allows that and our bylaws allow that.
And I'm fine either way, if someone wants to take over or want me to stay till January and the new person takes over.
So when is the recommended date?
As if you would like to extend through December, and then there's always the chance to renew at that time. Trying to get everybody on the calendar year cycle as opposed to this carryover of endings that were happening in September.
So then I would move to extend Dr. Harvey's term until December 31st, 2025.
Well, we say the January meeting date,
The January,
so
okay.
that then you could potentially select the
Does the
replacement.
same thing need to be done for the vice chair or the?
At this point, it's just Dr. Harvey's term.
Yeah. You're stuck with me since I'm the commissioner.
That makes sense, having to go through the
Yeah,
January
January,
meeting date,
yeah.
whatever that is.
I'll amend that then. Yeah.
14.
So January 31st, 2026.
Second.
All right, all in favor?
Aye.
I will stay on until then, and then I am planning on moving aside and doing other things, but it's a total privilege and I appreciate that you're happy to have me stay till January. Let's see. Next, I don't know if you guys all had time to read the the health officer and director's report, if you have any questions. If I have something.
I will add just one thing. Also in the packet are some flyers from our 2 back-to-school immunization clinics that are being combined with broader events. It's not just for back-to-school immunizations. The Chehalis Tribal Wellness Center Health Fair. So there are some extra materials in the packet to point out that are also listed in the health officer director report there. And then if I can just take a couple more minutes for our back to school immunization clinics and that sort of thing. We are, and this is a little bit overlap with the subcommittees, so those members will talk a little bit about that, but we do have our community health assessment. So just to recap, in the past, every 3 to 5 years, the hospitals are required by joint accreditation standards to do a community health needs assessment. CHNA, slightly different for hospitals than for public health. Our public health department has not done a community health assessment in a very long time, for as much as I could look back. Maybe we did that a while ago, but we are doing a continuation from what the hospitals did that we helped participate with them in the spring. And we are now where they were doing qualitative assessments with a lot of nonprofit CEOs and people that are involved in health in various ways. And so we're taking that to the next level as far as doing an assessment on people of Thurston County. And so that assessment will be rolling out tomorrow at the back to school immunization clinic that you will see here. And we would welcome any of you to come help participate and try to administer that to the public as they're at these events. It's a simple 8 questions, 5 minutes. We have several other events coming up, such as our Project Safer Developmental Disabilities Association Ice Cream Social, the Thurston County Emergency Preparedness event, the Chehalis Tribal Health Fair, Tumwater Falls Fest, etc. So there's many opportunities to help if you are interested to help us get the community health assessment out, and we will share more information on that too.
Couple questions.
Go for it.
Thanks. Well, one of them is a comment on the vaccination flyer Spanish. There's a couple of mistakes. I'm happy to highlight those and send them over to you.
Yes, please.
And then I wanted to ask about the measles. And last I heard there was a possible case in Pierce County. And so I'm just wondering like what we're doing here locally to prepare. Have we heard anything from the federal government? Kind of cringing a little bit of that, but have we heard anything from the federal government on any assistance that they're going to be providing during this time? Or have there been any guidelines?
So I can't speak directly to the Pierce County case. I don't know enough about that, but our communicable disease team is tied in. Anytime there's a case in Washington, we get the information. Our communicable disease team is geared up and ready to do that case investigation and all the work that's entailed. That's a mandatory through code that we follow up on any communicable diseases, especially ones like measles. So we are ready and we have the funding to do that and the staff to do that for measles or any other communicable disease. But there is no, and there probably wouldn't be particular unless it became a really national issue, such as like COVID became a national issue, to have extra funding for a communicable disease that when there's one case or a few cases at a time that it can be managed.
Yes.
So I'm struck by the pertussis. And I guess first, I'm wondering if there's anything locally that we're specifically responding to this pretty large increase in cases. But I'm wondering if statewide a quarter of the infants who had pertussis were immunized or had vaccinated, whatever is the right word. Is that generally true in our population that we have many fewer infants immunized?
I would have to, I don't have the exact numbers in front of me, but I could certainly gather those. And certainly the lower the vaccination rates, the higher chance for communicable diseases to spread.
So one thing that is really important to point out is that most of the children who've been hospitalized with pertussis at Seattle Children's, the mom did not get teed up during pregnancy. It is very effective. And especially because you can't sure, I can start immunizing you at, 6 to 8 weeks, but it's to get you fully protected, might be 6 to 8 months. So that is one of the ways to get that bridge of immunity until we can vaccinate. So I think any pregnant women, encourage them to get their Tdap during their pregnancy, because that is one way you really can impact that little kid. Because most of the kids that get hospitalized are under 2. I had one case that it was 18 months this year that was very sick. So
Nice. After our great healthy mom and baby presentation we just had, I'm just wondering if it warrants some specific response, or if it's such a big current that it's hard to push in terms of reluctance to be vaccinated.
There's
Yeah.
certainly a lot of discussions going around. We'll be having a provider breakfast or dinner this fall, to sort of really talk about what can we do different in this day and age to help increase vaccination rates. So we work a lot with the school nurses. We do presentations, lots of social media. So we continue to do efforts, and there's probably new and improved ways we could do that.
Thank you.
Dr. Harvey, clarification, is it a booster shot for pregnant women? Or just making sure they're immunized in the first place?
no, it's every pregnancy and get a Tdap.
Question on community health assessment. So is there like a schedule? We're supposed to do it every so often?
There's no mandatory requirement, but more and more, and especially as I was looking at the data to inform our programs and services, and we don't have necessarily a community health assessment to inform our programs and services. So this is really a first good swath to look at what does the community feel are the needs and gaps in our community, so that we can then bring that data back, especially to you as the Board of Health, and to really say, here's what we're seeing, here's how the community feels. Combine that with over 100 community health indicators that our epidemiologist team is putting together. So it'll come through as a whole community health assessment with many other data points with the hospital CHNA to really give a clear picture of Thurston County's health and wellness.
I'm sure that it probably needs updating, but when you said like you haven't seen one done and it has been done in the time I've been on the board. That's probably a long time at this point, but.
Yeah, I would love.
So
to
you
see-
make sure that you have what we have, so it's probably good to compare or.
Yes, I've tried to find if we had past data or whatnot, unsuccessful. We have lots of the hospital's CHNA data for every 3 years, for the past 20 years or so, but
Almost certainly
our
in my
own.
first year or two, we had that information come forward, but in touch base.
we love it. See it.
Any other questions? All right, thanks. So it looks like we are now at our subcommittee report out. If I missed anything. So I think we have an education and outreach subcommittee update.
Yeah.
Their class.
Thank you, Chair. So Dr. Freiheit gave a really good intro to kind of the work that the Education and Outreach Subcommittee is kind of pivoting to, and we would really like to help with the community health assessment process. So I'm really excited that we're kind of launching that program now. I think it's going to be really beneficial for the community, and finding ways to get that assessment out and get that survey out to as broad of an audience as possible is something that we really, really want to support. So I'm looking forward to attending the immunization clinic tomorrow at the Resource Hub block party to help with that survey in between all the other meetings that I have. And I invite and welcome Board of Health members to participate, not creating a quorum at these events, but hopefully finding ways to come out and help with getting the survey out there. So as Dr. Freiheit said, there are quite a few events coming up, and so I would really just encourage Board of Health members to keep your eye on your email. And if you notice that there are events that you have availability to attend, we would love to come have you help with the surveys. We'll have a couple of tablets to kind of talk to people and get their answers. You can help walk them through it, or just, I think, give them the tablet and let them do it there with you. So we can support community members in filling it out, or also just give them the autonomy to fill it out on their own. I'm really looking forward to seeing how much data we can collect through that process. And let me just make sure I have. Yeah, so some of the notes that I took from our last subcommittee meeting are that Board of Health presence at these community events is gonna build trust and reach underrepresented groups. So I appreciate the staff for kind of working on figuring out some small incentives to kind of encourage people to participate. I think that's really exciting. And I do have some key events on here, but I think those will be covered via email. So if anyone has any questions, the one thing I want to note is that if we have 4 Board of Health members or more, then that creates a quorum, so we'll have to be mindful of that. Because we would have to give public notice, of course, if there was gonna be more than 4 people, so. Also, for long events like tomorrow's immunization clinic, I mean, that's pretty short notice, but as an example, if we have longer events that take place throughout the day, staggered shifts for those volunteer times would be appreciated. So that's the update I have for education outreach. Are there any questions?
I'm curious what the incentives are that the staff came up with or what that looks like for people.
We actually have questioned through many different events, the actual public to find out what kind of incentives they like. So things like water bottles, ice packs, usable, tangible household items as opposed to like the fluffy pen or things like that. So
Portable chargers, I think, was that on
yeah,
our list?
portable chargers.
Yeah, that's something that I know a lot of people are interested in. Yeah, so I really appreciate the work you've done to kind of get the information you need to have incentives that are actually gonna encourage people to participate and things that are tangible that people can use. I personally know from doing outreach in the encampments that portable chargers are very, very appreciated, so.
That was actually my piggyback question regarding our houseless population. And, you know, a lot of these events, I'm so happy that we're doing these events because they're public health based, they're going to bring the community together. However, those tend to, from my experience, people who are living in a houseless environment do not necessarily feel welcomed at events like that, right? They're not necessarily going to be jumping to do something like that, especially outside of an incentive, right? Like bottled water and like a portable charger. So do you guys have currently a plan to outreach to specific groups or known encampments like that? Or would you like support from the rest of the board to
Yeah,
We
talk
have
about?
many ways that we're getting out through all of our teams internally and our divisions within the department. And so these are just some of the ways. There'll be social media, press releases, all of that kind of thing to help get out in all the various ways. So our Office of Housing and Homeless Prevention in particular for those.
Thank you. I'm like,
that
yeah,
population
social
will be-
media isn't necessarily
Right, right,
for
right.
our houseless neighbors, but I
Exactly.
gotcha.
Many,
Okay.
many different ways.
Yeah, no, and I, just to kind of add on to that, I really appreciate the question. That's kind of something that I've been wondering too, and I know staff are working with the Office of Homeless Housing Prevention, Homeless Prevention, OHHP. I just know the acronyms at this point. But, yeah, so we are kind of reaching out to make sure we're reaching those vulnerable populations. And if I might ask Dr. Freiheit, you may have mentioned this, how long will the CHA be open for? How long is this gonna be running?
So it will be open for several months and we're not putting a close date on it because what our epidemiologist team will look at is the demographic data to make sure we're covering all the various demographics. And then if there is a demographic that we're not necessarily hitting by month 3, we will devise ways of how to reach out more appropriately. So
Perfect. Thank you. Any other questions? I look forward to seeing you all in the community with me to collect some data. I'm excited.
I hope it's a big turnout tomorrow.
Me too.
All right, and next committee is data. Maybe, do you have an update, Provo?
Well, the update was similar, so I think Commissioner Klaus covered most of it. I encourage you guys to take the surveys so that you know what, if you come out to the community events, you know how to present it to people and help them through it. Yeah, if you have any other ideas for outreach or events that you would like to see if they could pull this together, they already have a long list, but I'm sure they would be hearing from you.
I actually have a question.
Yes.
Since kind of these two subcommittees are connecting on this initiative for the CHA, and it'll be announced on social media, I would also kind of just encourage, like I heard, Board of Health members can share this survey with people in our lives. So that's one way, to your question, Tanzania, that we can get this survey out to a broader audience by distributing it ourselves through social media, through conversations, just talking about it as much as we can. We're all in different community groups, and so if we just talk about it everywhere we go, we'll hopefully reach a broad audience, and then staff can kind of evaluate. And that was one of the goals we talked about. I think the data subcommittee meeting was making sure we're evaluating, the epi team is gonna be looking and making sure if we don't have certain populations that are underrepresented, then there will be specific targeted efforts to make sure we're reaching those populations as well.
Great strategy. And then policy subcommittee, any updates, Commissioner Mensah?
Yes, so we spent the majority of our meeting discussing operational permit certificate fees. There is a backlog of unpaid fees, and staff's trying to sort of clean things up and figure out what to do about that. There's a few different approaches that were suggested, and we kind of debated the pros and cons of that. So I think, looking at my notes, we're gonna have some follow-up at our September policy subcommittee meeting. So there'll be more to come on this, but just in terms of you guys knowing what we're talking about, there's different strategies for how to deal with these, and like I say, pros and cons. Then we went to a review of the again, a septic related topic, the management plan that's being updated. A full draft of that plan is coming. My notes say mid-August, so soon, I would guess. That's still on track. This is an update to a 2016 plan. And there are 6 buckets of recommendations, and there are different activities, and then there are ways to fund those various activities. And it's kind of been broken out in a pretty user-friendly way, where like the activities are kind of laid out by how much it would cost. Like if we were to assess a flat fee by activities, you could sort of build a menu of like, okay, here's how much we're gonna charge to do these things. And then there's like tiered approach, if you wanted to sort of tier it the way was proposed in the past, to try to, you know, maybe charge more to the marine shorelines where there's shellfish protection issues and stuff versus South County areas where it's less critical, or less acute, some of the issues. Anyway, so that's all gonna be presented to the Board of Health in maybe this fall. So there's some preliminary just vetting and discussion that went on about that. And then we were told that some updates to the drinking water code will be coming in November. So that was kind of the rundown of what we covered. So.
Thanks. All right, so next agenda item is the open Board of Health discussion and information sharing. And we did get some requests prior to the meeting. And first up is Commissioner Klaus.
Thank you, Chair. So this item I requested to be added is related to the Thurston County Therapeutic Courts. We have a few therapeutic courts, but I wanted to specifically highlight the Mental Health and Veterans Court. You may remember that Judge Buckley came and spoke during public comment for the Men's Health Proclamation. And afterwards, when we had our we have standing one-on-one meetings, and he was extremely thrilled at the opportunity to come and participate in public comment. And we kind of realized that there's a direct connection between the work that they're doing in the therapeutic courts and the work that the Board of Health does, because there are a lot of health components that are highlighted and worked on in those therapeutic courts. So in my conversations with Judge Buckley, he asked that I give the open invite to all Board of Health members to attend any of the mental health and veterans court sessions. They're open to the public. The Veterans Court is held Wednesdays at 10:30 in courtroom number 1, and these are at District Court. The Veterans Court is modeled after the Mental Health Court, and Mental Health Court is held Thursdays at 10 a.m., also in courtroom number 1. I want to also kind of note that and this is kind of comes from the Thurston County website, but individuals who participate in these therapeutic courts, we also have drug court. Some of you may be familiar with that program. I know Commissioner Grant is really passionate about these programs as well. graduates of mental health court and veterans court experience increased family connections, improvement in their lifestyles, and a sense of dignity and self-worth, and empowerment to strive for future goal attainment. And then the motto is a whole community working together towards justice. And I've personally attended some of these court sessions and I don't leave without crying. It's really, really moving. You watch people who are transforming their lives through these programs that have given them a second chance, and really focusing on the individual. And like we talked about earlier during the overdose awareness proclamation, really addressing these issues through a public health lens. And that's the core of what they're doing. That's the work they're doing in these therapeutic courts. So I just wanted to highlight that. And Judge Buckley asked me to thank the Board of Health for hearing him during the public comment period. And he looks forward to kind of keeping his eye out for agendas that may be related so he can come and speak again. So I just thought that that was a really good connection. I was excited that he was so pleased at the outcome. And yeah, so that's kind of the update there. I just wanted to let everyone know that they would be thrilled to see us come and attend and watch those sessions.
I have a quick question about that, just a follow-up or like a point of clarification. So that sounds very interesting in general to me. That's something I would want to do, but I'm curious about what the follow-up would be in terms of scope. Like we, as a board, I'm going as a private citizen, right, to watch, and then coming back within this space and then essentially discuss situations that like the Board of Health could try to address, or like, you know what I mean? Like, how can we
Yeah.
bring that work back here and talk about it or do something about it? Like, what does that look like?
That's a good question. I think if we take it upon ourselves to attend these therapeutic courts and have things we want to highlight, I think it'd be great to bring it back for open discussion at Board of
Okay.
Health meetings. Just kind of figuring out where these connections in the community are. It ties back to the work the subcommittees are doing, and ties back to the strategic plan. It really gets people out there and it spreads awareness about the really great work that we're doing in Thurston County. So I think, yeah, just bringing it back for open discussion and keeping things in mind. If you hear something that might be relevant to the Board of Health, it'd be great to talk about it. But yeah, I think just like a sense of awareness and really seeing the transformation that's happening in these therapeutic courts is the purpose of it. But of course, if you have things to bring back, that would be great too. I would love to hear from Board of Health members if you do decide to attend. Yeah, thank you.
And any other items that we didn't have any other email suggestions, but sure.
There was the second item.
The second, I'm sorry, I forgot you
no.
had two.
That's okay. This one actually came up, let me pull it up. After a Law and Justice Council meeting in July, where we talked about data standards. So some of you may be familiar with this, but some may not be. The prosecuting attorney's office launched a data dashboard on their website to kind of track the flow of felonies in Thurston County. There's a lot of really good info. It's a really interactive site where you can decide, filter, like, I want to see the demographics of people who have committed these types of crimes in this jurisdiction, or you can see like which police department, or if it's the sheriff's office, it has every jurisdiction's law enforcement entity. And you can see how many arrests are being made, where they're happening, where people live, like not where people live in a creepy way, but like the zip codes of where people are committing crimes and where they live, because there are some, statements that have been made about people coming to Thurston County and they don't live here and they're committing crimes here. And you can see some of that data in the public facing dashboard, which I think is really great. So through these conversations, law and justice stakeholders and partners have talked about what it would look like to create data standards, because we don't want like the sheriff's office dashboard to say something different than the prosecuting attorney's dashboard if they're looking at the same piece of data. We want everything to be streamlined in a way that's consistent, so we're not seeing different things in different places. So the Law and Justice Council is creating a data standards work group, and they shared the charter for that work group with us at the July meeting. It's just a draft. But the reason why this is coming up in Board of Health is because we were kind of brainstorming who should be a part of this data work group. And because we have the CHA that's being launched now, I threw out the idea of hey, maybe we should talk to public health because they're collecting data too. And if we're collecting data in law and justice, it's probably gonna be relevant to what the Board of Health is doing. So that's why this update came on the agenda, just to kind of share that information. I don't have any asks of the Board of Health, but it's just kind of like for your awareness, this is something that came up in another committee that I'm assigned to. So I just wanted to bring it here for everyone's awareness.
And anything else you wanted to add on the community health assessment?
Nope, I'll just be sending an email with more details and
And will it have a link, like, so we can take it?
absolutely.
We can share.
Awesome.
Great.
Oh, I have one question about that actually.
Yes.
What is the age range of people you're trying to survey? Like how, can children take the survey? How young?
We don't really have a specific how young,
Okay.
but it's certainly open to I mean, it's, you know, teenagers or whatever. In the demographic questions, I think there is one on salary, so they could skip that. People can skip
Okay.
any question, you know.
Okay.
Yeah.
Thank you.
All right. And then again, if you wanna add anything to the next meeting, don't hesitate to email and we'll add it to the agenda. Okay. No. So next item, is to review, two applications for appointment to the Pest and Vegetation Management Advisory Board Committee. And Kimberly Graham for Environmental Health will provide us with more information on the committee and the applicants.
This starts on page 19 of your packet. So there are two applications that you can glance through, and I do believe there are two open seats. Two open seats. So we do have two applicants and two open seats. Needing Board of Health appointment.
And I think the applications were pretty clear and easy to read. I don't know if anyone has any questions on them. All right, would anyone like to make a motion to appoint one or both applications to the Pest and Vegetation Management Advisory Board Committee? Or if there are other concerns, we can wait until the next.
Madam Chair,
Mhm.
I would move to appoint Cole Webster and Jacob Whitcraft to the Pest and Vegetation Management Advisory Committee.
Second.
Quick question, are there term limits assigned to these specific?
I will get back to you with an answer.
Short term or full term.
This is a committee that I think the terms are a lot longer just because it's hard to fill some. of these
Yeah.
seats.
All right, so I heard a second from Commissioner Mensah, and all in favor?
Aye.
And any abstentions or opposition? No? All right, that passes. It's nice to have two applications. I feel like that's always been hard to fill. Right. And then next, we will hold a public hearing regarding a proposed amendment of Thurston County Sanitary Code Articles 1 and 2.
Yes, Thurston County Public Health and Social Services is proposing code updates to Article 2, which governs food services in Thurston County, and Article 1, which directs enforcement actions. Article 2 updates will include aligning with the adopted WAC 246-215, incorporate existing policies, clarify local requirements, and broaden our enforcement authority. Article 1 reflects the enforcement update proposed in Article 2. That's how they're connected. And the articles were posted for public comment on July 31, and no public comment has been received. So we have Jesse Smith, our food program manager, here to go over a few highlights. And if you have any questions.
Okay, so this is Article 2. So the state creates the food safety rules that actually dictate like temperature requirements and hand washing requirements. And so our code is more the implementation of permitting structures and enforcement, those kind of things. Just a general overview, there's not a lot of major changes, a lot of clearing up language, updating to meet the WAC changes that happened a couple years ago, type of thing. Some of probably the biggest changes, currently, if you're operating without a permit, in the articles, we can issue civil infractions through the court system, for those operating without a permit. With the change, we're proposing to add civil penalties, which are kind of a lower level thing. I'm not aware that we've ever actually issued a civil infraction and don't intend to use those kind of things on any kind of, hopefully ever, but at least regular basis or periodic at most, type of thing, but it would give an additional tool to use to try and move people into compliance, get their permits. Our primary goal obviously is, you know, get them into our permitting system and approved and operating under the code and not deal with fees or enforcement as much as voluntary compliance. But that's probably the biggest change that's being proposed. Some of the other proposals are to kind of streamline some of the stuff. So right now, restaurants with a catering add-on permit can go do festivals, but the code requires them to fill out a 4 or 5 page application every time. And we're trying to remove that application process and just say, if you've been approved for this operation and approved menu, we'd just like you to notify us when you're gonna go do a festival or something like that, without submitting an application or getting another permit. It kind of reduces our time spent reviewing them and their time filling them out, where we feel we've already gone through a review process and they shouldn't be operating safely, type of thing. Some of the enforcement section, we've updated some of the language to put into the code what we already do through policy. So like for re-inspections or closures, we base it off points. Points are vary based on the risk factors. So we look at high risk factor ones towards these things. So like hand washing violation is worth 25 points, where something lower like food worker cards is just 5 points. And so if they got 50 points, we historically do a re-inspection. If they're at 100, they're subject to potential closure, depending on observations. And so we're kind of just updating the code to reflect policy changes, not policy changes, but to reflect the policies. We did more recently in the last year or so added to the policy that for repeat high risk factor violations that don't generate any additional enforcement like re-inspections or closures, we're asking them to follow up with us within 2 weeks. Like, what is your plan to stop repeating this violation going forward? Did you make corrections for long-term correction, type of thing? And then removed some sections that no longer applicable for state code, like certified food protection manager that got added to state code. So we removed it from our code. We are proposing to also change for annual food establishments, our risk category names from low, medium, high, minimal to just like level 1, 2, 3, and 4. Those restaurants that are categorized as high risk don't like to be called high risk, to get the perception that eating there is a high risk to get sick or something. And so we want to kind of move away from that terminology with them, type of thing. I'd say those are the biggest changes. There was a summary of changes in the packet that kind of went through it a little bit more detail. Don't know if anything else that really point out.
All the sad faces like in Seattle.
We're not proposing to do placards on doors or I'm not the biggest fan of that, but for various reasons, there's pros and cons with rating systems on doors and stuff.
Thank you. So my question is, once this is adopted, right, what's the education and outreach to street vendors, community members who are interested in pursuing this? Right now there's kind of been an influx of street vendors just based on our federal situation here in Washington State and in Thurston County. And I've been stopping and talking to every one of them and asking them, like, do you have your health permit? Like if you need any help, let me know. I can help you through that process. But you know, what's been kind of like, what's the plan once this is adopted? What's the plan for outreach towards people who are wanting to do this? And then also towards, as we're going in toward the Christmas season, right? And you have your local tamale lady, which I do, right? It's like, how are we teaching, like making sure that people are getting their food safety handler's card, being sure that they're, you know, if they are selling from home, it's not something we can enforce, but like making sure that they're safe and that, you know, so what is the plan?
So, with street vendors, I mean, it's gotten delayed a little bit because we've been spending a lot of time on our database implementation, but we are working on a updated guide to give a lot more information and get it translated, to really kind of go through all the ins and outs. You know, our current guide's one page and it's not super helpful for people who want to go through the program. So we are going to be going through that and really doing that. We also want to create a video that we can post about the process, those kind of things. We have had multiple street vendors that started out unpermitted go through the process and are now permitted in the county. We get a mix of those where some just aren't interested in getting permitted and some didn't know and they're willing to go through the process and go through the program and get it. Typically the ones that aren't interested, they come from out of the area, they operate up and down the state, the coast. And those ones we communicate and we hand out the options, because it is pretty unique in Thurston County to have the street vending program. Most of the rest of the state does not have that at this point, though I do believe other counties are looking at it. So it is something we try and promote as the first thing when we're going to talk to a street vendor. Like if we get a report, because usually when we get a report, it's most likely it's some other food establishment letting us know that there's somebody out there that's undercutting them as competition and type of thing. But so we go out there both to let them know they need a permit to operate and provide that education when we go visit them. But we are working on certainly improving our outreach, but first we need to really develop our guide to make it more informative about the whole process and how to go through the process. And then when they're looking to go through the process, we'll engage in translation services, or one of our staff who does plan reviews speaks Spanish for those kind of ones. We'll help them out.
Any other questions? Oh, hello.
Thank you.
Commissioner Ford.
I kind of feel like we might have missed something or something, because we're holding a public hearing, but there's no public. However, just like a month ago, several of us were attending meetings with restaurateurs in the community in Olympia. I know Clark and Commissioner Mejia, and there was a lot of comment about this very thing from the restaurateurs. I mean, right? Am I right? There was a lot of things. There was a lot of things that were said at those meetings that would be very appropriate in this room during public comment. So I feel like we had to have missed something, because they should be here, or they should have provided public comment. So like, I mean, I'm not comfortable passing anything until we maybe do some further outreach. But I mean, the public hearing is occurring as just a performance right now with no public comment.
And I wasn't there, so I don't know what they
Yeah.
commented on, like.
That's why we need to get them in here.
I mean, if it's street vending.
No.
Yeah, that's outside of, because it's not allowed to be put in our rules, but.
And I've gotten a lot of comments over like menu changes over the years. So I know a lot of restaurateurs that they have things that they would love to tell us.
Have we reached out to the chamber? I know that Thurston County Chamber was the one that convened the restaurant owners, so that might be a good place to start to see if we can have that, get access to those comments, or even potentially a focus group of people that are willing to come in and specifically write comments.
I remember you said there was contact with certain stakeholders, because I remember asking in the policy subcommittee meeting, who's gonna be mad at us if we pass this thing? Like, who's gonna feel that this is some kind, and you were saying that
Well, and like I said, I mean, we're not making any changes that that affect existing food establishments. The change, these are all things that are already in place. These aren't like, we're not creating new stuff as part of this. The only new thing would be towards unpermitted vendors.
For me, like, I wait for these moments when you guys put a policy in front of me that I've been wanting to like dive in on for 15 years and restaurateurs have been, Wayne, wait, why can't you change this? Why can't you say something about that? Why do I have to go through this crazy process to get, lettuce added to my cheeseburgers at my restaurant? And then I want that moment and I patiently wait for it. So like, that's all I'm saying is like,
Right.
maybe we can.
And some of that's dictated by state code, like when they're required to submit plans and stuff is already stipulated in the state regulations.
Yeah.
I mean, adding lettuce to cheeseburgers, I mean,
It's
that's
a
obviously.
silly example.
But
But
yeah,
there's a lot of restaurateurs that I know that know this stuff just as well as anybody that works here. And they've always had these like ideas and I don't understand them because I'm not you and I work, but I'm like, well, maybe what they're saying is making sense. And I would love that comment to get on the record here and us to address it. But like, I feel like we missed it.
and that'd be great, and I would prefer even they're reaching out to us in advance so we know what the concerns are. I mean, I've only been here a year and a half
Sure.
and, I haven't had, I mean, people don't like it when they get a lot of points. I mean, that's always gonna be, a place of contention. And then, sometimes, our risk category change, like if somebody's going from a medium to a high, people don't like that because it adds to the cost. And that's just based on, you adding processes where typically the change there becomes you're going from medium high because you're cooling foods and that's one of our highest risk processes. So that adds a layer on the levels, the level 1, 2, 3, or 4, those kind of things. I mean, yeah, we can do more outreach. I would say our ability to communicate with establishments has not been set up very well because we don't have a lot of email contacts and stuff like that. Historically,
That's why I recommend reaching out to the chamber because they have a great network of that. And to Commissioner Mentzer's point, this is about making sure people have advance notice. We live in this space as government workers, so we're in it day in and day out. Folks out there will need to be tapped to turn and look. Otherwise, they may be affected by it and then feel like they weren't communicated.
It could be an opportunity to share some of the efficiencies you're also creating.
Absolutely. It was a good idea to take the horn. So, and I'd be happy to put you in contact with David Shafford and we can work collaboratively on it.
but yeah, and certainly anything that they would like to provide to us as far as the conversations they had with commissioners. I mean, if there are areas we can improve, I mean, we want to know that information, what they're feeling.
Yeah, and we want to find the right areas to provide this comment and to help guide the organization. I just heard, especially the one that you all went to, there was a lot of comment, especially around this subject, and I would hate to miss the opportunity to.
I asked specifically about like that question. That's why I think we heard so much comment as the restaurant owners were speaking about other issues. I was like, okay, Board of Health and Inspections, how is that going? And so we heard some feedback on that. I'm wondering if it's okay, Chair, that I ask my question.
Yes, of course.
If we were to extend the public period comment piece of this, what is that going to put us in a situation where, there's difficulty or, is this something that staff needs to like submit to the state? Like, are we operating under any kind of timeline?
No,
We're
we
in
can
no rush.
definitely extend the public comment period and reach out to.
Why don't we just have a public hearing in like 2 months, and that gives you a month to reach people and then a month for people to formulate their comments and come back or show up. And so in October, then we could hopefully have heard what we need to hear and pass the code changes if we're comfortable. Does that make sense?
There's plenty of time.
Well, I'm hearing two kinds of threads. One is to try to elicit some comments on these changes, that a lot of this is housekeeping cleanup that I think is not gonna be controversial, but sort of as a respect, if it went to the chamber and the Washington Restaurant
Hospitality.
Association also helped convene bar and restaurant owners from around the county. If they were just given an opportunity to review these, they both have staff who can help facilitate that. And then I also hear the interest in more broadly sort of focus grouping. How's it going? Food inspection program. And since we've got it opened up, is there any other, I don't know, really important to restaurant owners or low-hanging fruit that we might clean up from their perspective? So I like what you did, and I think it's important that we opened it up. It's aligned with current state laws, and he cleaned up some clunky language. I don't think there's anything wrong with that, but I think it might be in our interest in terms of the people who could be frustrated, not because of the substance, but just because of not being included, that we also consult them.
Yeah, that's a great point.
So I guess I would move to extend or have this public hearing at our October. You made the recommendation, Commissioner Munster.
I'll second
Okay. Right, all in favor?
Aye.
Any opposition? Nope. All right.
Thank you.
Mr. Snake.
For a second, I was trying to find the date. I was like,
All right.
I'm sorry, I missed who seconded that.
Madam
Thank
Chair.
you very much.
Sorry, I keep forgetting to call it out for you.
problem.
Right, so the board will now meet in executive session pursuant to the position of health officer as allowed by RCW 4230.1101G.
Yeah, okay.
Jen is like, not it. Such a bummer.
Like, I don't even know exactly for that, so I'm not happy.
All righty, so
Send an email if we do move forward.
Oh, good.
If it can come from Melanie as Board of Health.
I'll keep an eye on my email. All right, I call the regular meeting back to order. And then the next order of business is adjournment. We have a motion to adjourn the August 12th, 2025 Board of Health meeting. Mr. Mentor, a second, please. Second, maybe. All right, all in favor?
Aye.
Any opposed? All right, we're out of here. Maybe next month and maybe earlier.